welcome. Thanks for being here. I am Sarah Bartel from ChangeLab Solutions. We're so glad to be able to be joining our partners at GEA for the second of this two-part webinar series on policy tools for rural equity and prosperity. Part 2 here is on the policy development process and some policy examples. Both webinars are recorded and will be posted online, so feel free to check them out along with all of the resource links that we're referencing today, as well as any that come from you all. So if there are any resources you'd like to share in the chat for the hosts and panelists, we're happy to incorporate that in what we share out with all of the registrants later. So let's start with a word from our partners at GEA. Abby?
Thank you, Sarah. Welcome, everyone, and thank you for joining us today. My name is Abby Nellis, and I'm an associate with CAGCA's Geographic Health Equity Alliance, or GEA for short. GEA, in partnership with ChangeLab Solutions, is excited to present part 2 of the Policy Tools for Rural Equity and Prosperity webinar series, Policy Development, Process, and Examples. GEA is a CDC-funded national network dedicated to reducing geographic health disparities related to commercial tobacco and cancer, and is jointly funded by CDC's Division of Cancer Prevention and Control and Office on Smoking and Health. Using a community-led approach, GEA specializes in helping state tobacco and cancer programs and their partners, such as state coalitions, local public health departments, and local coalitions, build capacity to implement effective public health practices, such as policy, systems, and environmental change strategies that positively impact community health. GEA is committed to improving the health of communities across our nation, and the purpose of this webinar series is to provide state and local coalitions with tangible examples of how upstream policy solutions can be used as tools for addressing systemic barriers to health and prosperity. We encourage you to visit our website, geohealthequity.org, to learn more and subscribe to our monthly newsletter. Next slide. I'm sure we are all familiar with Zoom by now, but I'd like to go over a few housekeeping notes. All participants are muted by default. We will have a Q&A portion at the end of the presentation. So for any specific questions for the presenters, please use the Q&A box. You will receive a post-webinar email with the recording of the webinars, slides, and an evaluation survey. We kindly ask you to fill out the survey. Please note, letters of attendance are given only upon completion of the evaluation survey. I will now pass it back to you, Sarah.
Thanks. Our learning objectives for today are to identify ways to engage rural residents, including BIPOC communities, in decision-making and policy processes. 2, to discuss policy solutions and policy alignment opportunities that can address the root causes of inequities and foster rural prosperity for all. And 3rd, to identify examples of successful upstream policy wins and lessons learned, which tracks directly onto our agenda. Edgar?
Welcome, everyone. Bienvenidos. So thank you, Sarah. We're going to start by recapping last week's session. Then we'll be walking through the policy process as a tool for health equity itself. We're going to revisit opportunities for policy alignment and goals using the upstream policies for rural equity and prosperity that were introduced in the last session. And then finally, we'll close by sharing some community wins connected to tobacco and cancer prevention policies. I'm joined today by my colleagues, Sarah, whom you already met, and Tyra Satchel. We're uniquely connected to the strains of research we're discussing today. You will be receiving a copy of the slides. Therefore, we've hyperlinked our names here if you'd like to read more about us, or if you're interested in connecting with us or other ChangeLab Solutions staff, who will be mentioning in the next slide. And we want to acknowledge them because these projects belong to many of our colleagues at ChangeLab Solutions, as well as other partners that we'll be calling out as we go. So we just want to say thanks to everyone. It's been an honor and thank you for sharing this work. Also, we included hyperlinked resources throughout the presentations, which also include specific acknowledgements for you to check out later. With that being said, ChangeLab Solutions is a national nonprofit, and we believe in advancing equitable laws and policies to ensure healthy lives for all. We believe that everyone should get a fair shot at living their best life, regardless of where they live, what they look like, how much money they make, or where they get their news. We are an interdisciplinary team of lawyers, planners, policy analysts, and other professionals. And we partner with state and local governments, organizations, and anchor institutions to invest in thriving communities. I'll pass it over to Tyra.
Thanks, Edgar. Hi, everybody. I'm Tyra Satchel, a policy analyst at ChangeLab Solutions. So because of the many partnerships and our lawyers on our staff, we have several disclosure slides to get through, so please bear with us. Obviously, parts of this work were funded by CDC, both the Public Health Law Program and the Office on Smoking and Health, OSH. But we are not lobbying today and do not represent the views of the CDC, HHS, or any other of our funder partners. In general, this is another disclaimer slide that says that ChangeLab does not provide any legal advice or does not enter any attorney-client relationships. We're just providing research and information. So as many of you know, as many of you are also funded by the CDC, you may want to check out this guidance explaining lobbying and limitations of what other activities are allowed. And finally, we recognize the many ceremonial and traditional tribal uses of tobacco, and we intend to discuss only commercial tobacco today. I'll pass it back over to Sarah because I think she had a note about this also.
Yeah, I'll add that we use the term BIPOC in these webinars when the research that we're using cites it. But we know that the diverse experiences and cultures and sovereign nations described in that term cannot be dissolved into a monolith, as with the term rural, right? We name these terms here not to disclaim them away, but to open the path for conversation and exploration as it relates to the concepts we're discussing and have been discussing in this webinar series. Which brings us back to our meeting agreements that we shared last week that we want to return to today. Let's all agree to create space for each other and avoid interrupting. We try to avoid distractions and be thoughtful about our language, speaking from personal experience and avoiding generalizations. We will also be aware of our intersecting and overlapping power dynamics. We will participate without resisting facilitation, so use that Q&A function and help us create interesting polls today. And we'll assume best intentions, but also realize that there might be slippages between our intent and our impact on others. And finally, our goal is not always to agree in these settings, but to gain deeper understanding. So as a teaser, if you haven't seen it or didn't attend, or a recap of our last meeting, we shared our team's research into the legal history of structural racism and structural discrimination, with implications and present-day impacts on health inequities in rural places. We shared many policy menus, and assessment tools for considering how those upstream policy options might inform and improve our work, regardless of our specific policy areas. Starting with one of our core strategic publications at ChangeLab Solutions, the Blueprint for Changemakers, we introduced 5 fundamental drivers of health inequity that are embedded in our systems and our institutions. They are structural discrimination, including structural racism, income inequality and poverty, governance or any decision-making that limits meaningful participation, and disparities in opportunities like jobs and education, and then finally, disparities in political power. We view our challenge to be changing the distribution of healthy environments, economic resources, and other opportunities by shifting how law and policy are used to shape communities and promote health. These upstream drivers of health flow through the 5 approaches we're incorporating into this webinar series, starting at the center from law and policy as levers controlling how resources are distributed, out to the fundamental drivers of health inequity, including the legal history of structural racism research shared in the last session, and the geographic place-based angles through our rural community research and practice partnerships, as well as our consumer product portfolio through tobacco, food, and related consumer systems. You may recall this slide pulling together the threads of rural disinvestment and discrimination, tobacco and food industry influence, and structural discrimination based on race, ethnicity, and class, all woven together along this timeline. The legal history of structural racism presentation started with the Doctrine of Discovery and the colonial settler framework over here on the left, with separate components for Indigenous, anti-Black, and immigrant discrimination and oppression. The research then flowed through the Constitution, 14th Amendment case law over 100 years, and present-day interactions between levels of government that all tell the mutually reinforcing story of structural discrimination in culture and in law. It was an intense grounding in a difficult history. Edgar, what came next?
Thanks, Sarah. Yeah, those overlapping and cumulative histories have affected and are still affecting present-day health inequities. Using our guide, Advancing Racial Equity in Rural Communities, our colleagues then shared a number of strategies to support opportunity, health, and justice in rural places and among rural partnerships. In addition, we crosswalk policy solutions discussed in our Rural Prosperity Guide, focused on equitable development along with place-based policies from our Blueprint for Changemakers. Finally, culminating in a rubric of assessment measures from our policy scan for advancing rural equity and rural prosperity to help us evaluate which policy options might best align with our work in our communities and with our partners, which we'll be diving in further today. With that said, Tyra will share another tool from last week, which will serve as a launch pad for our conversation today.
Thanks, Edgar. So this is the tool that the CDC's policy process wheel, and it's a useful roadmap reminding us of how equity, that is community partnership, and power sharing with those whose lives are most affected by the issues can be infused at every step of the policy process, resulting in better policy solutions and directly improving health outcomes when done right. Which leads us to our next agenda topic. I'm going to pass it back to Edgar to start talking about the policy process as a tool of equity.
Thank you, Tyra. The Rural Policy Assessment Tool looks at core measures of policy impact across place, race, and class, and includes measures that are dependent on how the work gets done, such as community engagement, optimizing community assets, and evaluation and monitoring of intended and unintended consequences. For these measures, I'll look to our resident lawyer today to summarize how and when these policy components can improve rural health equity and prosperity. So what do you think, Sarah?
It depends. Such a lawyer thing to say, right? Though at ChangeLab, even our non-lawyers or soon-to-be lawyers like Tyra are often heard saying process is substantive, that process matters. Tyra?
Yes, the policy process reminds us that equity is about more than health outcomes. Increasingly, research ties elements such as agency, ownership, community voice, data sharing, and accountability as moments in the policy process when civic engagement can itself be a driver of better health. So the policy process can contribute to trust building, shared values, asset framing, honoring differences, community connection, and cooperation, from how you plan, implement, and even enforce and evaluate your policy efforts. That is, every step of the cyclical, iterative policy process wheel can be an opportunity to advance health equity. So let's talk about some ways we can make law and policies more equitable in this context. For example, by 1, centering the experience of those most affected by the issues. By 2, understanding problems as well as goals and strengths. 3, by using and sharing data and research thoroughly and in partnership without being executive. 4, by aligning actions across partners, both community and governmental partners, and sharing power. 5, by embedding equity into implementation and enforcement. And finally, 6, by integrating equity analysis into policy evaluation. So at the heart of it all is ensuring equitable and effective community engagement. So here are some ways to center the experiences of those residents in our communities whose lives are most affected by the issues we're working to address. So start with what matters to the people by asking them. Some common ideas may come up, such as fairness, well-being, protecting our youth, and supporting local voices and local businesses, including other local governments. In the case of tribal nations, we can partner with communities to vision and frame issues rather than engage community for feedback around solutions designed by others. We also want to avoid defining people by the issues and barriers that they are facing, and we do that by honoring the systemic, community level, and upstream drivers and pressures that are unevenly and unfairly allocate options and opportunities. We can partner to build on existing strengths, community resources, and social connections while simultaneously working to address factors that undermine people's ability to accumulate knowledge, data, wealth, and other kinds of capital. So I work with Sarah on our tobacco prevention team in partnership with CDC OSH, and we've worked hard to center our approach to tobacco policymaking around equity and community-driven solutions. So thanks for the next slide. So here you can see some of our key equity-focused commercial tobacco, retail prevention resources mapped along every step of the policymaking process. We encourage you to check out these resources and any tobacco-related work, and we will be sharing the slides this was said earlier, but even for those not thinking about tobacco policies today, there are some aspects of the suite we'd like to share in more detail because their takeaways cut across policy issues. So this is one example. This is the strategic brief called Justice in the Air, which includes a suite of resources we developed in collaboration with our colleagues at Frameworks Institute, based on extensive research that included thousands of interviews, surveys, and focus groups across the country over multiple years. This helped identify the most effective ways to change the conversation around commercial tobacco. So the brief itself highlights the idea that with the right framing, outreach can be more effective and mobilize affected communities, generate support among bystander publics, and educate policymakers on the importance of action without lobbying. So these tools help practitioners infuse their messages and conversations with some of the community-centered principles I've just shared. And the principle transcends issues. The key takeaway is how important it is to frame and reframe your messages for every audience, every different room you enter, and to build alignment and support with your efforts. So this is an example of another tool that transcends issues is our equitable implementation and enforcement guide. As we all know, actions taken in the name of public health can sometimes harm, discriminate against, or otherwise undermine the health of the people whom the laws are meant to protect. Enforcement that is carried out inequitably can create, maintain, or exacerbate health inequities. Equitable enforcement, by contrast, can hold wrongdoers accountable while protecting the health and well-being of individuals and the wider community. And finally, I wanted to share our policy process evaluation for equity web tools. So here we've collected research and metrics exploring how to evaluate the impact of policy-related community partnerships on health across 4 categories. So those categories are partnerships are worth the time, different types of data can help you create a comprehensive narrative, and how we can talk about the policy changes, how policy works. So this is another honing in on the 4 categories. So centering community, sharing power, building trust, and equitable enforcement. And these references and checklists provide conversation starters for communities, hoping to better account for and measure their engagement efforts. So these are some of the ways Change Lab has unpacked how the policy process can be a tool for health equity. We also believe in pursuing policies proven to further health equity. I'm going to pass it back over to Sarah.
Thanks, Tyra, and forgive me for being off screen. I'm having some connectivity issues, as you could probably tell. But yeah, we work to further policies that are themselves striving for equity, not only the policy processes affiliated with them. We look to policies that can initiate widespread change. Policies can enable and guide other activities and sustain those changes over the long term. Policies can also help us focus attention on structural problems, not on individuals. They can express values against bias, unfairness, and injustice. Policies influence the distribution and use of money and opportunity and power. And they can undo historical policy-driven harms. Which leads us to our next topic, policy alignment for rural equity and prosperity. Edgar?
Well, for this section, I want to repeat our gratitude for our Thrive Rural Partnership. This is an initiative of Robert Wood Johnson Foundation that aims to organize learning, strengthen understanding, and catalyze and align actions around what it will take for communities and Native nations across the rural US to be the healthiest places they can be, where everyone belongs, lives with dignity, and thrives. Toward Better Rural Futures included the following partners: us, Change Lab Solutions, the National Governors Association, Praxis Project, and the Center on Rural Innovation. This project involved extensive scoping and partnership research, followed by an in-depth policy scan and ongoing engagement with key advisors, which resulted in the suite of tools we've been going through for this series. We also conducted interviews, which included local organizers and rural communities of color and Indigenous nations, staff supporting state-level elected officials, staff at agencies, nonprofit leaders, and subject matter experts. In all, these interviews were across 17 states with a high percentage of rural areas. As we shared last week, one of the most essential takeaways from the portfolio is the importance of considering the fundamental intersectionality of place, race, and class as dimensions of discrimination when thinking about and developing solutions to address equity in rural communities. Although using an intersectional lens in rural communities is complicated and challenging, it is essential. The compounding effects are most acutely felt by BIPOC individuals experiencing persistent poverty in rural communities. As our colleague Shaniqua says, the intersectional lens plus community or resident voice is where the magic happens, which is our goal in this series. The way place, race, and class intersect with policy effectiveness and the impact of resident partnerships and centering lived experience, all those elements meet together in our policy scan for advancing rural equity and prosperity. This rubric crosswalks those measures across the many policies selected from our research and the many policy menus from resources shared in part 1 of this series. From there, we created a central list of policy solutions for discussion. Sarah?
Thanks, Edgar. While we're on this slide, I just want to remind everybody that we know you can't read this slide. We did pull out the evaluation metrics earlier, and we'll return to them later. But we did create this full policy list that all came up in our discussion last time and that we'll dive deeper on today. So they are agricultural workers' rights, bail reform, broadband expansion, ensuring access to health care and healthcare coverage. Both of those were picked up on the last session with participants. Housing solutions, entrepreneurship and small business supports, workforce development, tourism, native arts and recreational programs, paid family and paid sick leave, local hiring, universal pre-K, retail environment interventions, and water quality improvements and accents. So you may be questioning or brainstorming right now how these upstream policy solutions are related to whatever your current policy goals may be. Perhaps some are directly in your work plans, and we certainly saw that last week. Others, maybe they have to do with partnerships, partners you have from other sectors or other agencies or advocacy groups you've worked with. Maybe these are policies that top their list of priorities. Another way these upstream solutions might align with your work is through specific provisions that your policy could incorporate to better address community priorities. Finally, in thinking and talking about these upstream policy issues that might be necessary to build trust and reflect the lived experiences and priorities of your community residents and other partners. That's the thing about the fundamental drivers of health inequity or upstream root causes or even social determinants of health. They all carry the risks of jargon, alienation and aggregation and generalization. Yet, if done right, they can give you an in to talk about real life experiences, because these issues, which we all may be trying to address with different policies, they are not experienced in a vacuum. They accumulate and overwhelm all together. We've all experienced stress like that. So your policy focus may not always be the top priority for every audience you're hoping to partner with. When connecting your policy efforts to a wider range of upstream goals and priorities, especially those shown to improve equity and prosperity in some rural contexts, that may open some doors, not to mention some hearts and minds. So let's take some traditional tobacco prevention and healthy food retail policy interventions as a context, as a starting place for exploring some of the connections to these upstream policy levers. So for entrepreneurship and small business supports and workforce development, you can imagine a process or a policy that emphasizes stronger alignment with small business supports for retailers, for example, that you may often find sitting across the table from you in your work. For workers' rights and paid family and sick leave and local hiring, especially for policies affecting places of employment or outdoor workplaces, consider how a policy might intersect with workers' rights and local hiring. Other ways workplaces can alleviate stresses so commonly associated with exposure to and use of less healthy products. Tourism-related and recreational partnerships, especially with local tribes and native arts and recreational programs, can support the protection of resources and users of those resources, bringing in support to counteract any environmental harms associated with, for example, the prevalence and production of tobacco and other unhealthy consumer products. Housing quality and access could support policies that include increased quit supports and other complementary or scaled enforcement regimes, including, for example, eviction protections where there's support. Relatedly, healthcare coverage and access for both quit supports as well as upstream alleviation of stresses more commonly associated with higher rates of tobacco and nicotine use and exposure, and overuse of other less healthy products. Finally, water improvements and other environmental resource protection policy efforts, for example, could be an unexpected link, yet there are some documented success stories of such partnerships, especially among youth partnerships related to tobacco and other industries' waste or byproducts. And then, of course, the core retail environment and procurement strategies to increase access to healthy options and reduce exposure to harmful products. And with these, moving upstream to place-based strategies and systemic approaches rather than individual or behavior-based approaches. So this is where I'm hoping we can activate the brainstorming and the reflecting, and maybe the like questioning that you're sitting there thinking about by having a poll. So we can go ahead and pop up the poll. And the ask is, which of these upstream policies that we've highlighted from our research and resources for rural equity and prosperity feel either directly connected to your work, like it's a partnership or a provision that you are already implementing in your work, or might be an option for a new partnership or a new type of conversation. So let's go ahead and pop up that poll. And so ping me if I'm the only one not seeing it. There we go. Okay, great. So as you look through this, the example that I just walked through in the tobacco prevention space was just one example. And we know many people on this call are working on policies in broader areas. So it's up to you whether you want to identify the policies you're actually working on, or you want this to be more of an aspirational response. That's fine and useful. I know the poll won't show it, but I think it's useful for you as an exercise. So we'll give this just a couple more seconds. And then we'll see what we're hearing from our participants. I love this opportunity to sort of see who's in the room. I know the registration information included that, but it's nice for you all to see it too here. All right, finalize your suggestions and selections. And then Abby, we can go ahead and close it out. Okay. Wow, so interesting. Okay, so we've got Housing Solutions taking the lead at 56%. We've got high rates of responses for both healthcare access and coverage, as well as retail environment interventions. We also have broadband expansion. Workforce development is another one that's high up there. But how fascinating that we've got respondents for every single one of these issues. Which is really great to see. And I'm seeing in the chat that some people are sort of talking about what they're currently working on, but not what they think they should be working on. And this commenter is noting, if we included what we should be working on, we would check every single box, which is, of course, like true. and like one of the hardest parts about working in this area, right? Working on public health that touches so much. So take care of yourself, I think is one of my responses to this poll, even just in this, relatively small subset of responses. We have such a huge wealth of issue areas, and really it's not just policy issue areas, right? It's the experiences of our communities and our partners who are living these out, who need these priorities to be discussed and addressed. And doing so with government partners, I think is so important and reflects some of that process-oriented approach that Tyra described, but it ain't easy. Thanks everybody for participating so fully. We really appreciate your engagement on that. Also exciting to see your work. That's very cool. Lots of good work. All right, so now we're going to highlight some policy wins from rural counties across the US. Before I hand it to you, Edgar, I also just want to remind people, we are trying to hold a lot of time for Q&A. So anything that's coming up for you, feel free to open that Q&A function, especially as you listen to these policy wins and the possible connections and resources that they imply. We would really like to have a robust Q&A section, so don't be shy. And please also just contact us through the chat. You can contact the hosts and participants if you're having any tech issues. I know some people had a little bit of trouble with the poll. So we have our ears perked for other tech issues that may come up. With that, I will hand it to you, Edgar.
Thank you, Sarah. So we got 3 issue areas from which we want to highlight a few examples of rural policy wins. So they are workers' rights, broadband access, healthy retail environments. And now we'll kickstart it with Sarah.
Straight back to me, lots of back and forth. So first, workers' rights. Policies in this space can range from smoke-free and other environmental protections for workers, regardless of where they call their workplace, minimum wage protections, overtime pay, even housing supports, and paid family and medical leave. These are often upstream policy areas that reflect historical omissions, exclusions, or even discrimination for extending existing protections to workers in certain industries. You can click the link to read more about these historical practices and policies, also touched on in part 1 of this series, as well as further detail on community examples of policy solutions implemented in rural counties from, for example, Washington, Colorado, and New York states. Especially when we think of paid family and medical leave, something so many employees are able to take for granted or bargain for, yet so many are left out of that practice, that policy. And the downstream implications of this upstream solution span many policy areas: access to care for loved ones, limiting the unnecessary spread of illness, providing support for preventative and care services, including addressing substance use and mental health supports. Edgar, you take the next one.
Well, next in our example policy wins, we have broadband access. Policies range from community-owned network resources, cost scaling, workforce training, and infrastructure investments. These improvements can influence income inequality and poverty, access to jobs, education, and training, as well as healthcare access. These investments can impact many policy goals, wherever these fundamental drivers of health and equity are in play. You can read more about these examples from rural counties in North Carolina, Kansas, Oklahoma, all through this link in the slide. One great example I'll highlight is Greenlight, a community-owned fiber-to-home network located in the small rural city of Wilson, North Carolina. Greenlight is a municipal network operated by the city. And to ensure equitable access to broadband, it provides low-cost internet services to residents living in public housing and free high-speed access to all after-school programs, libraries, and community centers. The network has expanded to nearby rural communities of Pine Tops and Vic Valley Farms. And to support economic development efforts in Wilson, Greenlight offered a course that provided in-depth hands-on training to local residents to build a strong and economically resilient workforce and to keep wealth and other assets within the community. I'll pass it to Tyra.
Thanks, Edgar. Just want to shout out Dale's comment about the retail tobacco environment, because that is our next example. So finally, policy wins for healthier retail environments. So we've seen these collaborations spanning across products, reducing exposure to tobacco and nicotine, alcohol, and ultra-processed foods, as well as spanning different agencies such as environmental health, small business supports, workforce development, agriculture, taxation, code enforcement, and more. This can include interventions through policies such as licensing, zoning, incentive programs, or direct regulation. I especially want to highlight rural county policy examples that use licensing to reduce the density of tobacco retailers in specific parts of the community. For example, in Benton County, Oregon, where they set a 1,000-foot distance requirement between new retailers and existing tobacco retailers. Similarly, in Renville County, Minnesota, licensing prevented tobacco retailers from operating within 1,000 feet of schools, playgrounds, houses of worship, and other youth-oriented facilities. These changes shift the focus from individual behavior to street-scale environmental change. Moreover, such interventions can utilize small business supports, reinvestment, and other partnerships with local business owners who are, after all, also residents who are experiencing and whose experiences should inform our understanding of health equity impacts of our policies.
Yeah, and Tyra, the participants can't see the comments, so I'll go ahead and just share that this person is reflecting the tension between retail environment interventions and rural communities that might be really pro small businesses, and that retail zoning has to kind of, any policies work in that space has to take into account that tension, which is very real. And we also touch on it in a couple slides, I think, when we talk about the conversations we had in Wyoming. Tyra and I were just doing a training on this yesterday. Oh, and it's next. Okay, great. Yes. A couple years ago, I did a training in Wyoming at a statewide prevention and enforcement conference. So a room full of public health folks. There we go. The clouds are covering my window. So it was public health folks and doctors and other clinicians and law enforcement officers. And we were talking specifically about nicotine retailer licensing. And this huge hotel conference room and diversity of perspectives in the room didn't keep the conversation from moving toward the role of government in people's lives, especially when compared to the role of commercial industry in people's lives. So even though we provided a few access points to rural policy examples, we know that in every community, in every conversation, it will be different, even just different rooms in the same building, right? So here are a few reflections from that training with those Wyoming partners, illustrating how different these upstream policy conversations may look with different partners. The first insight is prepare to get philosophical. Public health policies can evoke political beliefs. We've got to reimagine a shared narrative together, one that acknowledges painful truths like those discussed in part 1 of this series, and envisions a future of shared health and well-being by whatever terms we might use to talk about those things. And in our framing work, as Tyra presented on earlier, and in other places where we're talking about the role of public health authority in our communities, sort of that shifting landscape, whatever terms we use to talk about this work, identifying those shared values for any partners and conversations and audiences we're having. One of the next takeaways from the Wyoming training was to really value community members and local strengths. And it was important in that room to clarify the distinction between business as industry freedom, funding, and power from those small businesses, just like this comment is emphasizing. What does the small business freedom and funding and power look like in the community? And finally, emphasizing those systemic factors. What is the history here? Who has driven that story and shaped our community, and who should own the solutions and the rest of the story moving forward? Tyra, do you want to talk about our next example here?
Yeah, thanks, Sarah. So another community example that carries this point really home is our team had the opportunity to provide a number of regional trainings and a state workshop in South Carolina last year, not California. It was so valuable for us to witness the specific variations among and within the regions that we work with in that state, and it makes you really reflect on how limited national, state, or even regional generalizations can be for messaging purposes. These conversations about upstream policy change are very nuanced and require so many different approaches and perspectives and strategies. Messaging basics like word choice and terminology are so varied, and they're hyper-local, as is readiness and awareness of these issues. So doing your homework and asking partners explicitly to identify those shared values together, that was essential for success. Also, youth-focused policies were almost always a strong start for a conversation about the systemic factors at play for these partners. I'm going to pass it back over to Edgar to bring us home with the final point.
Thank you, Tyra. While Sarah and Tyra look at the Q&A and the chat to flag anything we should bring into the conversation, I'll encourage you all to pop open that window and drop any questions or comments that this is raising so we can engage. I do see 2 questions in the chat itself. Not sure, Sarah, Tyra, if y'all are working on those, but someone brought up, Isaac brought up local hiring practices. Do you have ideas on how to encourage local hiring practices and to reduce these barriers? Anyone want to take a stab at that?
Edgar, thank you so much. Yeah, I think the question is really interesting because it's talking about interest and skills for the specific types of job where the specific key positions they're looking to hire into. And that has to do with what I think some people talk about, and I think this term kind of has its pros and cons, but the workforce pipeline. So not like local hiring is not just offering the position and looking locally, right? It starts earlier, whether you're thinking about the words that you're using to frame up that just job description, what the activities actually are, what the experiences are that you think can lead to success in that position, where you're posting and who you're talking with about the job, but also then all the way back to who holds the training expertise, the educational access in the community for these types of skills. And can you get tapped into those partners who really hold that knowledge, who hold access points to the audiences where you would be looking to develop those skills and interests at the outset? So, I hate to be like a broken record here, but I think thinking about upstream partnerships in terms of training and education opportunities is going to be a lot stronger than just posting the job and trying to cast a wide net in terms of finding enough local folks who are qualified for the position. Any other thoughts that people want to share? I think sometimes, actually there are some comments in the chat that I'll share out. I think someone's emphasizing that like even all the way back to educational opportunity and literacy being something that can be an important partnership or like research and like kind of humble approach to ask for information and tips from people who hold the expertise for those types of opportunities in your community. Someone from Minnesota is highlighting that the Minnesota state government recently removed the requirement of a college degree as a condition of hire for some specific jobs in the state due to state policy change. So there are even, policy solutions that can help us open those pipelines a little bit further and better reflect the true like range of skills that can make someone successful in different roles. And someone else's, the chat is blown up. I think so. I've got another version of the chat here, and I think Holly, if you're willing to come off mute, I'd love to have you bring that into this space. I think we have the time.
All right, thanks, Sarah. Yeah, I was just sort of reflecting back on our Rural Thrive project that you all heard a little bit about earlier, and thinking about how the local and cultural context really also is largely these hiring practices can be influenced by the local and cultural context as well. So it's important to keep those things in mind, as well as considering whether these industries and these skills are even able to be attained locally and culturally. And if not, asking the question why. And I think to your point, it is a nice first step, but often this takes a lot of time and energy to really walk this back and understand where and how we can improve on these practices. So thank you, Sarah, for letting me chime in.
It also really beautifully illustrates why local hiring might have broadband access connections, right? In terms of the training opportunities that are available in a remote setting that may not be available locally. Wouldn't that be cool? I'm sitting here hoping that someone's about to chat that they've done that work or have an example and a link. Also, someone else in our team, Shaniqua, I think was supposed to be here as a facilitator, and there might have been a tech glitch, but she's emphasizing how tax incentives for local businesses to emphasize local hiring is another like policy level solution, like the one that the Minnesota commenter proposed in the chat. Lots of really good thinking there.
And I think Sarah, like as Shaniqua mentioned, I know you shared what she was sharing, but that emphasis on small employers. So Isaac, like I think there's levels to the what local practices and hiring practices looks like when we're thinking industry, big industry, large corporation, but even small businesses and making sure that we're keeping the wealth and those assets within community itself. So being able to encourage the small businesses so they do thrive. So what kind of policies can encourage those small businesses, mom and pop shops, to stay within the community, within the rural context?
Edgar, that is a perfect transition to one of the other questions that's in the Q&A. Somebody working in Colorado on drinking water over sugary drinks and shifting the conversation about food systems, and who holds power there to re-emphasize food systems as a source of improvement for the environment and the health of our communities and not a detractor from those things. And the questioner is emphasizing the move into further conversations, including conversations in more rural areas. And they are highlighting the fact that the words policy and taxes turn people off sometimes, and for thinking about different ways to frame that message. And I have two thoughts. One is about the framing, which I'll just push pause on, because my first thought is policy and taxes turn people off for a reason. And that history, which I think we can all assume, but it's going to be specific to the communities you're working in, right? That history matters and it needs to be acknowledged. And so if policy and taxes have been tools for creating disconnect between government and community, is there a way to own that and identify a new way forward that policy and taxes can be used not to create a distance between government and community, but to bring them together and further shared goals and make that very clear as part of the policy process? So a perfect case study for how we might think about the importance of owning some of the historical issues that we talk about in the first webinar, as a way to create trust and authenticity to move forward for new change. I have some thoughts about specific messaging, which is obviously tied to actually differences in practice, differences in what we think about policy and taxes being used for, doing what they are actually causing to happen in the community. But I wanted to pause in case anybody had something to reflect or share or follow up on with what I just said. Shaniqua, I see you. Thank you. If you want to jump on to share your reflections, please do.
Oh no, we've moved past it. It's totally, I just wanted you to know I'm here.
Hi, welcome. Thank you. I'm so sorry I didn't see you. I hadn't expanded my view screen. Okay, so I'll dive into this framing a little bit. And Tyra, jump into, because I'm thinking about, we were doing a training just yesterday with partners in Indiana on the Justice in the Air report and on specific messages that are useful. And so when I hear taxes especially, I think about embedding wealth in the community. How taxes can be used to reinvest in community goals and values, and keeping some of that wealth, local wealth retention is another set of terms. But again, with all of these are words that can help talk about taxes, but only if the process by which you're thinking and talking about the policies actually do some of those things, right? So I think that putting your money where your mouth is in this context is literally quite important. And on policy, I think some of the conversation from the Wyoming example comes into play, where we talk about the role of government and the role of government policies, owning those historical harms, and finding a new way forward that the policy can be reflective of community strengths, community assets, community solutions. Those were my first my first thoughts with that. I'm watching the chat. I know we've got some like logistics going on in the chat, but I also want to, wow, a lot of logistics. But I'm trying to see if anything's coming through the chat in response to this question about framing policy and taxes. Okay.
I think, Sarah, I wanted to mention something as I think also thinking about, I think Tyra, a section of what we discussed was community engagement. Policy may turn people off, but it's also important to realize and recognize the assets that communities have. They're talking about policies and systems change, but they might not be saying those words. Also thinking about who shows up to meetings, who's showing up to these events to advocate for, to move the work forward, making sure you do have diverse partners in the room. Some of the most, I would say, most vulnerable populations, making sure that you're hearing from them. So I think part of this is also being able to ensure that we have community and we're centering community voice, but making sure that, especially within rural communities, that you're also hearing from everyone. So I think that's the one thing that, as I think about like the work I've done within rural communities, is you have to meet them where they are, but they are talking about policy. They're just not using that technical term of policy because they know what they're experiencing and what issues they're facing, but you need to ask them.
Yeah, and even in the terminology, which is, you know, some of our favorite CDC terminology about PSE change, policy systems and environmental change. You've got systems, you've got environmental, community level, upstream with that great, you know, the great adage that term comes from. These are all like, you got to know when it's going to be jargon and when it's actually going to just make sense to people and be intuitive. And it'll be different for different communities, for different rooms, as we said. Someone also dropped in the chat the concept of targeted universalism. So for instance, a policy that supports rural communities specifically might be a targeted policy, but then it can be rolled out to all communities and have universal gains, universal benefits. And I think this is something that was really emphasized in webinar 1, which is we have all these different threads of historical situations, policies that we are trying to address, to overturn, to repair. And that means it's really easy for us to feel like it's a zero-sum game and all of the work needs to happen in different spaces, that you can't sort of bring them together under one umbrella. Yes, there are risks, as we acknowledged at the beginning here, and as was talked about pretty extensively in the first webinar, based on a comment coming from one of the participants. There is a we here, that when those who are facing the biggest barriers have some of those barriers removed, we all benefit, we all gain. And how important it is to counteract some of that zero-sum default thinking and framing and put in place the moments where, again, we have that strategic alignment, we have those shared values. Even across the political aisle these days, right? Those shared values are there and they will be different everywhere, but that doesn't make them any less valuable for the policy process. So we are at time, so I'm going to cut it short. I know we had a few other things that came through the chat and we will follow up on that. Please, please fill out the survey if you would. We know it takes time, but it helps us improve our work so much. Thank you again to Gia. Thanks to you all also for the appreciation that's coming through the chat. We really appreciate it. You can see that link for the survey. And again, we will be sharing the recordings. They will be coming out along with links to all of the resources. They'll be posted online. You can come back to them. And please, please stay in touch. Thank you so much for your participation and for such an engaged Q&A. I wish we could have kept going, but we want to respect everybody's time. So thank you again. Take care And please, please be in touch.